Thank you for attending my presentation titled Pre and Post Redesign Usability Assessment of a Telemedicine Interface Based on Subjective Metrics, which was a study performed in collaboration with Dr. Helen Monkman. The organization of my presentation is as followed. I will first discuss the context of the study, then the significance and scope. I will describe direct-to-consumer telemedicine, then my methods, the results, and the implications of the study. Health information technology is an important and often essential component of the modern day healthcare system. Health information technology range from electronic health records, which aggregate and synthesize patient medical history and data, mHealth or mobile health applications to support patient education and behavior change, e-health, such as health information websites that disseminate health information and public health messages, remote home monitoring systems that transfer medical data from patients to clinicians for remote monitoring of health conditions, clinical decision support systems to enhance clinicians' diagnosis and treatment decisions, as well as telemedicine, which facilitates the remote delivery of quality, specialized healthcare to patients and enhanced communication between physicians and their patients through the use of digital technology. It is critical that health information technology have a sufficient level of usability for their safe and effective use by target users, which can include a variety of unique individuals. Usability has been recognized as a major factor impacting the widespread acceptance of and adoption of telemedicine. Teladoc is one of the largest and most well-known direct-to-consumer telemedicine providers serving a global population. Teladoc is available for use by the general public and thus targets a diversity of users. Direct-to-consumer telemedicine or virtual care is the synchronous, real-time delivery of healthcare from physicians to patients through remote technology or digital methods. Although direct-to-consumer telemedicine affords increased access to affordable healthcare and convenience, patients remain resistant to utilizing direct-to-consumer telemedicine services. Patients become aware of Teladoc through their consumer-facing website available at www.teladoc.com. Like other online sources of health information, telemedicine websites are often the first port of call for consumers to gain awareness of and knowledge of specific health conditions, treatments, and healthcare provision options. Thus, the usability of these websites is key to increasing patients' utilization of direct-to-consumer telemedicine. A remote, unmoderated usability study was conducted in order to evaluate the usability of a leading direct-to-consumer telemedicine provider's website prior to and subsequent to a redesign to understand how well the telemedicine provider was able to implement design changes that improved the usability of their website. It is argued that improving the usability of telemedicine provider websites will increase the widespread adoption and utilization of telemedicine. Both quantitative and qualitative data was collected, and this presentation discusses the qualitative findings only. An unmoderated remote usability test was conducted using a novel survey developed for the unique study context. Because direct-to-consumer telemedicine patients are able to access telemedicine from a variety of devices in nearly any location, such as from their home or office, an unmoderated remote usability test afforded a high fidelity study environment. Usability tests situated in real-life contexts of use have a high degree of fidelity and are better able to bring to surface the contextual and individual determinants of usability. A task-based questionnaire was developed to simulate a real-life context of use and interaction between a patient and a Teladoc's website. Quantitative data was collected as task completion success rates, and qualitative data was solicited for participants with one free response question asking them to provide suggestions to improve the usability of the website. The innovativeness of this study is established with the development of a novel survey that asks task-based and technology-specific questions to assess user performance, as well as captured subjective user feedback, and the remote delivery method that allows for the usability study to be conducted in a real-life context of use. In contrast, standardized usability questionnaires are recognized as system agnostic and only capture users' perceptions of an interface using rating scales. Typical usability questionnaires neither assess users' actual performance using a specific system, nor their perspectives of what could be changed to improve usability. Amazon Mechanical Turk was used to recruit participants to complete the survey that was facilitated by SurveyMonkey. Amazon Mechanical Turk is a recruiting platform that allows researchers to specify their sample population, and a diverse US population was selected, increasing the participants representative to potential teledoc patients. 50 patients took part in the first usability test of the teledoc website before it was redesigned, and 33 participants took part in the second usability test of the teledoc website after it had launched a redesigned website. The difference in the number of participants recruited for the second study was due to limited funding. A novel task-based survey developed in SurveyMonkey was used as the data collection instrument. The primary goal for using the telemedicine website for a patient is to be able to interact with the website successfully in order to see a doctor virtually. To be able to conduct the usability test remotely, the Teladoc website usability survey asked participants to attempt the typical tasks and interactions with the Teladoc website they would need to in order to set up a virtual doctor visit. For instance, one question asked participants to locate and enter the phone number to talk to a doctor. Another question asked participants to identify 3 health-related conditions that could be treated using telemedicine. Task completion success rates was quantitative data collected. The final question asked participants to provide open-ended feedback regarding the usability of the website. The user-generated feedback from this question was the qualitative data collected that will be discussed next. Participants' usability recommendations were analyzed as textual data using thematic analysis. An inductive directed coding approach was used along with an a priori codebook to code participants' usability recommendations into explicit categories of health information interface elements and features that impacted usability. There were 7 main codes and several subcodes related to each main code. For instance, the main code screens regarded any user interaction with the homepage and registration that may impact usability. The 2 subcodes were homepage and registration. Subcodes described more specific usability aspects related to the main code. New codes were added to the coding scheme and were distinguished from the repetition of certain terms such as contact number and detail, or inferred from the participants' overall statements. Although this type of coding is interpretive, a constant comparison technique was used, and having a detailed operational codebook strengthens the credibility of the findings. Results from the unmoderated remote usability test of the pre and post redesigned Teladoc website suggest that the redesigned Teladoc website did successfully rectify some previously identified usability issues. However, also appeared to introduce new usability problems when redesigning their user interface. For instance, prior to the redesign, the Teladoc website appeared to provide the type of information that potential patients search for or would desire to know prior to setting up a virtual doctor visit, such as the telemedicine physician credentials and action steps to walk them through the process of registering and setting up a virtual doctor visit. Also, the Teladoc contact phone number was prominently displayed on the Teladoc website prior to the redesign, and this appeared to negatively affect usability on the redesigned Teladoc website. For instance, one subject said, "I'm not sure the phone number to call a doctor was right, so that could be added to find them easier." However, the redesigned Teladoc website did appear to improve the usability related to the navigation and the display of some elements, such as font. The font size appeared larger, making it easier to see, and the contrast was improved in such a way as to improve the clarity of user interface elements, like the buttons and links. The main navigation appeared to be reorganized in a way that aligned with how users would navigate through the website. The navigation having been improved on the redesigned website was apparent from the fewer number of participants' comments that the navigation of the website was a problem in comparison to the pre-redesigned website. Overall, the redesigned Teladoc website seemed to improve the usability of user interface elements, including the font size, making clickable buttons better represent the function they allowed the user to perform, and implementing a more intuitive navigation website. However, the redesigned Teladoc website did not appear to deliver the type or level of detailed information potential patients desired or needed to know prior to using the service. These findings suggest that the redesigned Teladoc website had better usability in regards to the user interface design elements, but poor usability in regards to the human factor elements. In order to increase awareness of and safe use of direct-to-consumer telemedicine providers like Teladoc must have a usable consumer-facing website. Potential patients must be able to interact with the website in a variety of contexts, including stationary and mobile environments. Telemedicine appears to have promise, and findings from this study can be used to improve the usability of telemedicine providers' websites because the codebook identifies specific user interface and human factors that impact usability. Improving the usability of telemedicine provider websites will likely increase widespread diffusion of telemedicine. Usability best practices call for users to be involved in the design, or in this case, the redesign of health information technology in order to better design for usability. We strongly recommend user-centered design be practiced so that iterative refinements in the design of health information technology can be performed prior to the release or implementation of health information technology. User-centered design invites end users to participate in the design of the health information technology that is intended for their use and involves several cycles of usability testing and iterations in the design. The goal of user-centered design is to deliver usable health information technology that enable users to achieve positive health outcomes. Thank you for watching the presentation.